laugh. When she laughs, I want to laugh too.
That's
You
good.
know?
That's good. That's good.
So they're
Laughter is good.
connecting with your spirits. They're connecting. But we're really happy to be here with you this morning. I know yesterday afternoon, many of us thought, wow, what's happening on the outside?
Yeah.
The rain and the wind. But guess what? That heat really cooled down. And many of us, we slept a bit better last night. And so we are thankful for the rain that came yesterday. And it's anticipated that we may have a rainy weekend
Mm.
coming, this coming weekend, maybe a rainy one. We know that generally the peak season, that is the hurricane season, it tend to ruffle us a little September, October, when school is just about opened. And so it's a good time to, again, when you're doing your planning, include, planning for your children, ensuring that they're protected. And I've always believed in having my kids with two pairs of shoes, one when it's really raining torrentially, and the other one when the weather is bright. Even getting a pair of toe less that they can put on their feet, and when they get into the classroom, put their real
The
good
real
their
shoes.
school shoes on, and the raincoats, and the umbrellas,
Umbrellas.
and
Yeah.
all of that. So it's important to do that. But we are happy again. As I said, good morning to the farmers, the fisher folks, the NEP workers, particularly those who really keep the environment, spotless. We're saying good morning to you. Your efforts are not in vain, and we truly want to, appreciate you for the work that you've been rendering to country.
Carlton, I want to interject a special good morning to our retired people who
Oh yeah.
always listen to Health Vibes. Oftentimes, I get feedback from people who are retired and they're home and they say they are always locked on to Health Vibes. So, good morning to you all.
I love that
Mm-hmm.
category, that group. Yes,
Mm-hmm.
and we know that the retirees they have a wealth of knowledge and wisdom that they often can share with us. So again, good morning to you. Trudy, in way of announcement, we have some great news to share, and that is JP Nuff, Jolly's Pharmacy Nuff,
Mm.
Jolly's Pharmacy Portsmouth branch is finally here and is ready to deliver to the north and the northeast of Dominica. Our grand opening is this coming Friday, that is September 1. We're opening our doors from 8 a.m. until 6 p.m. So our
Wow.
hours are the same as our branches in Roseau, except for that of the megastore, because we know weekdays the megastore closes at 8 in the evening. However, the hours for Focally are similar to that of the two branches that are in town. And so we are excited. I can really guarantee you that you will be bewildered. You'll be quite amazed at what we are about to offer to you. We believe Portsmouth deserves better, and we are here to make that change.
Yes.
Our services will be second to none. And guess what? The prices are the same as Roseau. So there is no spike in prices. You would expect the same level of customer service. And I can guarantee you that all of the employees that are employed at the Portsmouth branch, they have been trained. I was one of the facilitators that trained them. And so they have gone through the rigorous training um, techniques, and information will definitely impact it. So expect to get the same value for money in terms of customer service, customer care, customer experience. So
Mm.
again, our Portsmouth branch will be opening September 1. That is this coming Friday from 8 a.m.
And Carlton, I picked the location for myself, and it looks impressive. And I think the people of the North are in for a great experience at that new location. It looks good.
Definitely. And as I've said, we're not in the business of competing with our stakeholders. We do have a large clientele in Portsmouth who purchases from our wholesale department. The main aim, as I've said, is healthcare. And healthcare must be universal, it must be accessible. As I said, as well as an example, a woman is in distress, she's given birth, she end up having some complication at the Portsmouth hospital. She's bleeding uncontrollably. They can't control the bleeding. The pharmacy will have the medicine to address that. No longer will that doctor be stressing out and wondering what am I going to do? I may have to transport the patient to Roseau, and you never know what could happen on the way to Roseau. And the very same thing is applicable to Marigot. You have the hospital there, you have the airports, and you have an international airport soon. Um, well, it's actually on its way. So you really need to have a strong pharmacy presence in that area. Hence the reason why we have um, decided to offer such a service to you, the people of the North and Northeast. On Saturday, if the weather permits, we're still looking at the weather because it is projected that we will have some rain. We are planning to have, we've done all the planning already, so it's just the execution. But again, it's dependent on the weather to have a Portsmouth edition of Megaland for the children. So it's a good end of summer activity. Those of you would have looked at our Megaland episode 1, 2, and 3 on Emo News, you would have seen how spectacular it is and how children and parents truly have endorsed such an activity. So we are planning, well, we've put together the Megaland Portsmouth edition that is scheduled for this coming Saturday, that is September 2nd, from 3 p.m. to 7 p.m. So you will have the Bongson Castle, you will have all the different games.
Yeah.
It's a beautiful environment, large yard, and your children will be safe, as we've always ensure their safety. On Sunday, this coming Sunday, I hope truly you'll be able to come with us. On Sunday, this coming Sunday, September 3rd, we are having our staff church service. It's an actual annual event that we do every year. This year, we were looking at doing it in Portsmouth during our Customer Appreciation Week of activities. But then Portsmouth wasn't ready as yet. Okay. And so we said, this year, it's Portsmouth year. We're having the church service in Portsmouth, and we're having it at the God's Family House of Worship. I think that's a Pentecostal church in Portsmouth at 10 a.m. This coming Sunday. Okay. Many of our staff have signed up. I think almost 100 have signed up for the church service. And so we will be worshiping in Portsmouth this coming Sunday at 10 a.m. And next Thursday, we are having a cardio jam in Portsmouth.
So all roads lead to the north.
is in Portsmouth this coming week.
Right.
Truly, I expect to see you there. And I will be there. I'm actually be there on Saturday afternoon doing the live. And we are anticipating a very, very nice crowd.
Yes.
Nice
I
crowd.
think people in Portsmouth are waiting for Jolly. So you all have all the activities lined up. So you're ready.
Yes. Trudy, are you back at the college?
Yes,
work
I
has
am.
begun?
Yes. Work began last week for me. So I'm back at work. So I'm no longer on vacation. So Carlton doesn't have to grudge, my vacation. We're back at work.
and I will be at the State College tomorrow morning.
Yes.
I'm doing the orientation.
The two of us
as a presenter. Right.
Right.
So we seem to be some way, somehow, always in in something.
Yes.
Right. But this morning we have a very special guest. It's someone who I truly admired. I truly admire. Present tense. She doesn't know how much I admire her, but I do. I like her calmness, her humility, the way she connects with people. And guess what? She's my child's doctor too. So this morning I said, Zinzaya, your doctor is going to be on this morning. She said, "Which one, Daddy? The new one?" Because there was a previous doctor that she loves. She still loves him a lot. But I said to her, "We're moving a little." And now she was, "Okay, I know. She was very nice and kind to me, Daddy." And that's in for you. So we have an amazing doctor. We're going to take a break, and then Trudy's going to introduce her to us. Stay tuned, please.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
I woke up this morning feeling real stink. I had the intentions to call in sick, but I end up in Jolly's Pharmacy. Great and down in Josh Street, Jolly's fix up my immune system. Got me feeling fit and strong, now I'm ready to work and pick on any mission. If you see me walking, Jolly's Pharmacy is number one, Jolly's walking. We cater for everyone, Jolly's walking. Boost up the immune system, Jolly's walking. Yeah. Yo, Dominic is the white father box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
And we are back. Of course, this is Health Vibes, and we always have vibes, and we have we have always important and interesting vibesy topics lined up for our listeners. And this morning is no different. And we do have a guest in studio. Carlton already preempted the introduction, by telling you that our guest is a doctor. So this morning in studio with us, we have Dr. Midalia Marie Cognet, who is a doctor that you may have heard of before. You may have seen her even at JP VIP experience that we had recently. And she is a physician who has a very keen interest in the health and wellness of children, teaching parents, I know particularly about children and parenting, and she has had a lot of initiatives in that arena. She's a doctor. Carlton said that he admires. I admire her as well. Dr. Cognet, good morning to you and welcome to Health Vibes.
Thank you very much. Good morning, Trudy. Good morning, Carlton. And thank you for having me on Jolly's Health Vibes. And good morning to the listeners of Health Vibes.
Good morning. I'm sure your parents are listening. They are a huge fan of our show.
Oh.
So I say good morning to them in
I wouldn't
Portsmouth.
doubt that.
Oh, nice. Yes, Carlton. Dr. Cognet, we decided to have you on because it's August. It's the end of summer, and a lot of focus now is on back to school. So I am back at the State College. I'm back at work. Students all over the place will be going back to school next week. And I believe something that we overlook often when we're preparing for back to school, we think about the books, the school bag, the stationery, the whatever, and we don't focus a lot, I believe, on the health and well-being of students, children, and what back to school means for them in that period. So we're going to be having a nice discussion about that. And I do hope that our parents can tune in and listen, very actively to the discussion we're going to have.
And that's well said, Trudy. It's one of the areas that even I is quite passionate about the health and wellness of our children. Oftentimes people take their children to the doctor only when something
Is wrong.
is wrong. So the adults may go to the health centers maybe every month for checkup, but the children would not be taken to the doctor often until maybe there is an ache, a pain, or something, a gripe. Doctor, children's health. Why is it so important, and why should we, be paying attention to the health of our children?
The very same reason we should be paying attention to our health. We want to make sure that we are in the right state of body, right state of mind. And I say right state of mind because a lot of time when we speak about health, a lot of persons concentrate on physical health and mental health tend to take a back seat. But when we speak about a healthy being, we speak about a biopsychosocial being, and we want to make sure that there is harmony between all three of those components. And so we want to make sure that our children, whether it's for back to school or at any time during the year, that their bodies are functioning how it's supposed to be. And when we do our screen evaluations, screen medical assessments, our well doctor visits, as we call them sometimes, it's the opportunity to find out if things may not be as we assume they are. Because a lot of times it's during those wellness visits, the so-called wellness visits, that we realize, okay, everything is not top notch. What we may think may be just a little symptom that we can brush off or treat at home, sometimes are things that are much bigger and need more intense medical intervention. And so it's always, and I say this for all ages, it's always good to have your general checkup annually. Always have your checkup, always have your children come in and assess whether they have an ache or pain or not. And the best time to do this is when you don't have to interrupt classes during their summer break. That's the best time to do it.
Doctor, what are you seeing in children? I know you've been working with children, generally in your career. What are some of the diseases that you are seeing in our children here in Dominica?
Well, just to clarify, I am a general physician.
Yes.
And so I see patients of all ages, and a lot of my clientele are children as well. And I am seeing a lot of infectious illnesses, so urinary tract infections, gastrointestinal infections, skin infections, and I am seeing quite a lot of allergic conditions. Skin allergic conditions, respiratory allergies, we see a lot of that as well.
Okay.
And especially in the preschool age and the school age children, so we say preschool age 3 to 5 years and school age 6 to about 12 years of age, we see a lot of children coming in with what we refer to as physiologic anorexia. And so we have that drop in appetite, and that's a big issue for parents. I mean, I'm a mom of 4, and I have had to go through that stage with more than one of my children. And a lot of parents get concerned, is it a medical condition that's interrupting their appetite or not? And physiologic anorexia, the physiologic means it's normal causing, not caused by any pathology, and anorexia just means a dip in appetite. A lot of times it's that the children have I like to say a specific appetite. So they are picky. They would eat a lot of one set of things, what they want, but what we would prefer to give them, they don't want it. And sometimes it's because of how we prepare it and how we present it to them. So we see a lot of children coming in with physiologic anorexia, but obviously we have to make sure it's physiologic anorexia. So we have to rule out all of the medical causes of decrease in appetite before we can see physiologic anorexia. But that we see quite a lot of.
Interesting.
What about things like womb infestation, anemia? Do you see
Anemia is a big one. Deficiencies. So let's not just say anemia. Deficiencies, because there are different types of anemia, but it's what we call ferropenic or iron deficiency anemia. That's a big one. And again, the physiologic anorexia is one of the things that causes this as well. And sometimes the children may not have physiologic anorexia, but the meals presented to them do not provide them with sufficient nutrients for their age, and they can develop anemia. See quite a lot of vitamin D deficiency now. We spend a lot of times indoors, and being persons of a darker skin tone, melanin has this sun blocking effect. So we have a higher risk of having a low vitamin D. So we're actually seeing children, adults too, but we're seeing a lot of children with symptomatic vitamin D deficiency. So that's another thing, again, that they may come in with headaches, and parents may complain that the children have a poor concentration. Teachers are saying the children not concentrating or the days off. Children may complain of body aches and pains, and sometimes parents just assume, it's growing pains. We don't want to make an assumption. We want to know exactly what it is. If it's growing pains, fine, but it may be something on the line. And I've seen recently a lot of body aches and pains in children, headaches and lightheadedness, poor concentration, brain fog. secondary to vitamin D deficiency.
Wow.
Iron deficiency causes a lot of fatigue as well, and headaches and lightheadedness. Those things are going to interfere with a child's learning abilities, going to interfere with their capability to be attentive during class. So a lot of times parents would come in concerned because, okay, something is not right. My child is not performing well. The teacher say the child is there, but not there. What is happening?
Dr. Cognate, what you're saying is so interesting. I just have a little question. As it relates to some of the symptoms you expressed for iron deficiency or vitamin D deficiency, the fatigue, the pains, etc. Sometimes parents might disregard some of these complaints because they might think it's, the child trying to avoid maybe going to school or trying to avoid some sort of, chore that they have to do. How does a parent really put it into context that this is an actual issue? What are some of the real signs or indicators that they can look for that this is not a fake complaint? Because I do know people will say, oh, school is coming up all of a sudden. She has pains or she has a headache. But when it was summertime, there was no such complaint. So how do we kind of navigate through that concern?
Let's look at recurrence. The child has this recurring complaint. Don't brush it aside. Whether or not it was present, it is present only during school time. It wasn't present during the vacation. It's recurrent. You want to have it checked out. And sometimes if we are very observant, we may realize that even when the children are doing their hobbies, they may not be their self, as we would say in Dominican terms. They may not be themselves. So they would not be as active or attentive during their hobby times as they would. So if it's affecting another aspect of their life, something that they really like doing, you want to pay attention to it. Sometimes children may complain and just have one little complaint that they mention it once, twice, and it never happened again. Fine. But when you keep hearing it over and over again, you want to have it checked out. So that's one of the things that parents have to look at. Assumptions can be a very deadly thing in medicine.
Sure.
Very deadly thing. So we want to make sure that all concerns are dealt with, and now is the best time to deal with it before the school term starts. We only have like about 1 week?
Yes. A
1
few
week.
days,
Yes,
yeah.
I'm actually preparing because I have school-age children. So yes, we have 1 week, and now is the time that you want to pay attention to all of those little concerns, make those appointments with the physician to have them checked out.
We mentioned earlier, and I mentioned a little about worm infestation.
Yes.
We have a culture where everybody runs to the pharmacy
To get the
to get the worm.
wormer, yeah.
You eat a lot of mangoes, you eat all kind of, as we would say, koshoni, to wash you out. And parents want sometimes, even I, when I was growing up, they give you this big cup of Sene to drink,
yeah.
and the
I've
whole
heard.
day you in the toilet.
I've gone through that as well as a child.
Right.
My mom has those memories
some
of
people
Sene.
Some people still use these things. Are they necessary? Should they be given to children? And at what age, if they are, at what age group they should be given to
So
children?
let me say, and I say this a lot to parents, I say this a lot to my older patients. All gastrointestinal infections are not worms. You have different types of infections, and all medications do not treat. So there's no one medication that's just going to treat worms, treat amoebiasis, treat. You want to make sure, and there's a simple stool OCP test. You do a stool OCP, stands for overcyst and parasite. So the parasites in its different stages of development. A simple test can tell you whether or not there is some gastrointestinal infection, and if there is, it will show us which type. So we can now treat for that specific infection. But I do not advise persons, oh, well, school is coming up, so just deworm. The child may not even have a worm. The child may have H. pylori infection, which we've seen a lot of as a matter of fact.
Yes.
And that medication is not going to do anything. So during our well checkup, a stool OCP, I mean, we live in the Caribbean, we live in a very rainy country. And sometimes, although we speak about proper habits in terms of water consumption, it may not be right sanitization, it may not be up to par. And so in our environment, we are exposed to a lot of infectious and in gastrointestinal infectious agents. And just doing the stool OCP during the well visit to make sure that there's nothing there. is the right way to go. So giving just one tablet and say, oh, well, so everybody just get albendazole and that's it, and you should be fine. No,
Yes.
it's
Yeah.
not going to cover everything, and there may not be something to treat in the first place. So why just give a medication?
That
And
is
we
interesting.
yeah, and we still have a lot of our parents believing, and my child blood dirty. They come to the pharmacy all the
Yes,
time with
I need
that.
to wash out the
You know,
blood.
yes, I see some boil coming up on the child, and they never had that before. I think their blood dirty, and sometimes you really try to educate them, and they just believe that notion that my child blood is dirty. I want to get something, aloe, tisane, something to clean the child blood. Let's talk a little about that. Is it something that you?
Let me tell you, many occasions I've had this said to me. But when it comes to educating the parents, our approach is very important. Persons will shut us
Yes.
down if we come as if I'm almighty doctor and I'm not going to
Yes.
listen to you and just hear what I say, and that's where we end. And so we want to make sure that when we're educating patients on such topics, because it's customary in our culture to think that we need to wash out the blood. And so when you're going to break that thought that this person have had from since they have known themselves, we need to approach them in a gentle, humble way, listen to them, give them the factual information, but not belittling them.
True.
And let me tell you, I hear this all the time. I need a washout for my child. And it's the same thing again. Persons think that there is one management for all infectious agents when it's not like that in reality.
True.
And it must be it, and I can assume it must be so difficult to kind of retrain a parent's mind when culturally that is what they know.
It
It's
is.
the same thing with the dewormer that we just spoke about. Culturally, you deworm in the summer, and that is
Yes.
just something everybody knows to do. That is what is passed on. So, doctor, I know you're very into teaching parents and promoting good parenting. Is there something that parents in terms of health can benefit from, to learn some of these, to learn and maybe improve knowledge on health of their children? What do you suggest?
So you made mention about me and teaching, but I would say I use the word passion. That's my passion. I love health education. And so I like to use scenarios, especially personal scenarios. I think I use them so often that some persons believe they know all about me. They don't know all about me, but I choose to use certain aspects of my life as a parent, my life as a child growing up, and things that I've had to relearn. When I know we know better, we do better. I like to say this quite a lot. And I've had to reteach persons, even within my family, about proper health practices and things that they believe were the way to do things, and it's not the way to do things. And so the approach that I use is to be at the same level as the person. As I say, that persons complain a lot of times. Persons would say the doctor doesn't listen to me. The doctor think they're more than you, and they just speak. So you don't come as almighty doctor. You come humble and you speak to the person. You use language that they understand, break it down in terminology that they will understand. So as I said, I mentioned earlier on physiologic anorexia, and then I went on to say it's the picky eater. So I like to have persons know what is the term they may hear medical persons use and what it means. So it's not because I want to speak at the language you understand, I shouldn't let you know this is what it means in medical terminology, because I have parents who right now you tell them physiologic anorexia and they definitely know what you're speaking about. And so I use words and terms that they understand to explain to them what the medical terminologies that we use mean. And then it's very good to show examples. It's good to show examples. So I don't just say, well, this is this and that is this. Well, for example, this occasion, this is what happened with me. This is what happened. This is how we went about it. This is what I used to think before I became a doctor. I had my first child before I was a physician. I was a very young medical student. Now I have had number 4 last year. What I know now, the way I go about doing things as a parent now in regards to health and health related things is definitely not the way I did when I had my first child, my second child, and the third who was just in 2020. I have come along. I learn. We never stop learning.
Constantly
as physicians,
learning.
right? We never stop learning. And so the more I learn is the more I apply it to myself. So I try to be an example to the persons that I'm trying to educate as well.
Well said. Well said. Doctor, another area that's of major challenge to parents is medication adherence. Doctor prescribed medicine to my 1-year-old, my 3-year-old, and it's a challenge to administer that medication. The child is running all over the place. The child doesn't want to take the medicine. The child vomiting when the medicine is placed in the mouth. What do? I'm losing my hair. I feel like I wanting to beat the child. I don't know what to do. Doctor, how can I get help in this area?
I am giggling because you just described my 3-year-old before, not now, because I have gotten her to the stage where she would accept medication better. But if my husband is listening, I think he was probably nodding his head during that entire speech that you gave. One of the things, the children become very overwhelmed. First of all, you have adults who tell you, boy, I hate that medication. It is horrible. A lot of the medications don't have a flavor, and sometimes they have a flavor, not a flavor that the child may like. Remember, we say they are very picky at the things that they consume. So it might be a cherry flavor, and they don't like cherry, and they don't want that. But the other thing, again, we tend to restrain them the wrong way. I advise parents, don't try to just administer the full thing one time. You hold down the child, and then you just open your mouth, and you just send everything in. The child is going to spit it back up. The child is going to feel like they're going to, what's going to happen is every time they hear the word medication, it's going to have this almost like a traumatic response from them because it's not a nice time. And so what I did for my daughter, who is 3 years of age now, if I tell her you have to take your medication, sometimes if she doesn't feel well, she say, Mommy, I need medication. But you would not believe how she started off. So she was a child who, she didn't get sick a lot. And that's the thing. So children who may not have had the opportunity to, or they didn't have the experience of taking medication from the early stages, now they have to take it. It's a new thing for them. It's not a nice experience. They give you more of an issue. Children who've had to take medication from neonatal stage or from early infancy, they tend to get accustomed. Routine is a thing that children like. And so when it's not part of the norm for them, they're going to put up some resistance. And what I did with my daughter, I would tell my husband and my bigger daughter, this syringe, we're going to give her a quarter now. Let her go. Let her run around. We give her another quarter, probably a little more than that. Let her go, let her run around, and then give her the rest. But one of the things we're going to do is when we have to take medications, we don't comment in a negative way about the medication.
I was about to I was thinking that.
So my bigger daughter, when she had to take medications, like, boy, that's nice. Mommy, I'm ready for my medication. Boy, that's nice. Boy, that's nice. Best believe she's 3 now. So she would say, I'm ready for my medication. Boy, that's nice. My bigger daughter would compare it with something that she likes. She started comparing because children have modeling behavior. They model us. And so when they start observing how you respond to administration of medication, they model that as well. And one of the things, sometimes I am guilty for doing it, and I have realized it really doesn't help. It's something that we as physicians tell parents a lot of times to put it in their food. But when medications have a strong flavor, what happens? The children develop aversion to that food. And now you have a problem where the child doesn't want medication and they no longer want the food. So it's best to get them accustomed to the medication. There are pretty syringes right now, pretty little cups, nice ways of putting making it a bit more appealing for them to take the medication and not just sending it down the back of the throat. You want to squirt the medication to the side of the cheeks because you don't want them to aspirate the medication again. That's one of the other reasons why you may have the gag reflex coming up and everything comes up. So you give it to them in small portions. Don't make them feel like they're in a fight with you, and don't have a negative reaction to your own medication.
And I believe in that too, because I'm a parent and I believe, and I have a young daughter too, in sort of amplify, let me say that, sort of empathizing with the child's feelings as well. A lot of us as
Mhm.
parents, we forgot where we were, and we were once children who had to endure, sometimes even a beating, a belt wrapped around your mother's hand, in lieu that you did not take that medicine that you're going to get scolded. Now that we know better, so one of the things that I do, I sometimes give my daughter a reward, or I give her a star, or
Yes, nice.
you let her know every time she takes her medication, she gets a star, or she gets $1 to put in her cash thing. And I have not really had issues with Zane taking her medicine. She hates injection, which is something that most children, when they see a physician, they think of the immunizations that they would have received, and they begin to cry. What's
And
this
because a
about?
lot of times parents tell children, if you don't behave, I'm taking you to the doctor, and this for them to give you an injection.
Yes,
So that's not
as
a
a-
good
as a
thing to say to a
punishment,
child.
yes.
Yeah, that's
Right.
true.
So they
And
to them
fear is
injection.
learned.
Yes.
Learned.
Right.
Yeah. I've seen it too, even like if you go to take blood, the phlebotomist, like I've seen a phlebotomist trying to take a parent's blood, and the parent is reacting with so much anxiety that the child in the room starts to cry.
Mm.
So
And they
I've
were not
seen-
the one having the
and the
blood
child
drawn.
is not the one having the blood drawn. So, this kind of fear of medical intervention
Yes.
is learned from the parent and their behavior. I've seen that live.
But Carlton, the reward system, that's something I personally use. So
Mm-hmm.
that's when I went to Jolly's on King George V Street and bought a sticker book for my daughter. And that's one of the things we would give her a sticker. Where you want your sticker now? On my hand, on my forehead. And she would go around with her sticker, very happy because she did what she had to do. She took her
Yes.
medication well. I took my medication well. I'm a big girl. When I
Yes.
realized she was excited about starting preschool, she's starting preschool next week. Every time she did it, I would say, you know what? I'm going to tell your teacher you were a big girl, and now she's excited. She tell my teacher I took my medication.
Yeah.
So that's one of the things. Realize what interests them, what they love, and
what
we can
motivates them.
use it. What motivates them? Use it to help coax them to take the medication
Mm-hmm.
instead of having this whole negative reaction to
Because
it.
they do feed on our energy.
Yes,
Feed on our energy.
let me tell
And
you.
so
Yeah.
I like that. And it's a good way of bonding with your child too. It's a way of the child recognizing that you recognize that they have a right, they have feelings, and you can coach them and you can bond with them. So I really like that. What we're going to do, let's take a short break, and then we will give the numbers if you want to call and ask Dr. Cognet any question, and then we will continue today's discussion as we're focusing on children's health this morning.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
I woke up this morning feeling real sick. I had the intentions to call in sick, but I end up in Jolly's Pharmacy. Great and down King George Street, Jolly's fix up my immune system. Got me feeling fit and strong, now I'm ready to work and take on any mission. If you see me walking, Jolly's Pharmacy is number one, Jolly's walking. We cater for everyone, Jolly's walking. Boost up your immune system, Jolly's walking. Yeah. Yo, Dominic, say why Father Fox. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
So we're back with you. Thanks for staying tuned. Again, the numbers are 4493095, 4493096, 4493097, 6164257. And as always, you are always welcome to connect with us if you reside outside of Dominica. That number is 305-432-9624. We have Dr. Cognet in the house, and we're talking about children's health this morning. Trudy, you were going to?
Yes, I want
Yes.
I wanted to shift gears. We spoke earlier, Dr. Cognet, about physiological anemia, or what you referred to sometimes as
Anorexia.
sorry, or what you referred to as picky eating, maybe. But I
Mm-hmm.
know there are parents who have been complaining that particularly during the summer, there has been a lot of overindulgence in food, and they say, you know, they need to put a lock on their fridge because the children have been eating straight throughout the summer. Some parents are complaining that maybe there was some weight gain over the summer as well. What is your recommendation, or what do you say to parents with those concerns?
So we experience that a lot. I say we because as a parent, oh my goodness me, summer vacation, I feel like I work to feed. But one of the things is the lack of the organization. So in school, there's a set time to eat, a set time to do your work, a set time to do this. We have this leeway during the summer vacation, and sometimes they may not be as occupied as they would have been at school. So with all of that free time, they may comfort eat. They have access now to a lot of the snacks, the foods that they would prefer. And during the summer break, a lot of parents are still working, and
Yes.
sometimes the children may be left with persons who may give them a little more leeway.
Grandparents.
And so, yes, so they come back from the summer break with a little more weight than when they ended the term. And it all has to do with they occupying their time, and they didn't have a lot of activities to do. And sometimes they do have the activities to do, but it's not in that organized way that you would find during school time. So there is, you eat your breakfast, you go to school, there's your 15-minute break,
Snack,
your snack break, you continue schoolwork, then there
Lunch.
is lunch break. Then some persons may have, a lot of children have the extracurricular activity, and then after that you have your afternoon snack, you have your supper, you do your homework, you have your supper, you go to bed. During the summer break, there's a lot of free time.
That's
and what
true.
you going to do with that free time?
Yes.
Just consume. That's when their mind is now on, oh, I'm hungry. During school time, they may be so occupied, they may not even realize the hunger cues kicking
That's
in.
true.
But during the summer break, and they're free to do what they want, oh yes. So that's one of the things that actually contribute to that increase in appetite.
Yes. Well, we see children as well. We see that, again, our culture, we love, especially grandparents. They love to see their daughter, the granddaughters plump.
Yes.
Thick. The child looking too mega. So what would you, because I mean, weight, you do weight in your assessment and so forth. What are you seeing in terms of our children's weight?
We have a lot of obesity, overweight and obesity in the young and younger ages. Actually seeing children who having glycolated hemoglobin, or that's the amount of sugar attached to their hemoglobin, more on the higher end than what it should be. We're seeing children who are at risk for diabetes, and it's quite surprising to some persons, but type 2 diabetes is being diagnosed in young and younger ages, and it's because of diet and lifestyle choices. And one of the things that happen during school time, parents may stress a lot on healthy eating during school time, and then during the summer break, give that ease. But then it gets difficult for the children to go back to that healthy eating. And a lot of times, healthy eating for the parents is putting your taste buds on a brick. And so children would see healthy eating as a punishment. And so parents get frustrated and say, well, I will just give the child what they want. And by continually giving the child what they want, which is not the healthier options, we notice children have been wearing more than their weights is more than their age range should be. We do have to take genetics into consideration as well, because you have some persons who genetically are prone to be obese and overweight. But if we are aware of that, then we have to change the environmental factors around the child. We have to start putting things in place to control the child's diet, increasing the child's activity, so trying to stay away from a sedentary lifestyle, and deal with it in an early stage, because a lot of times when persons want to deal with it, it's when it's progressed and it's a bit more difficult to tackle. So we do see a lot of children in younger ages with obesity, and in our environment, that's when persons will tell you, you look good. somebody who is within the normal weight
You may.
for the age. Yes, you may.
You need to eat
That's
some-
a term that was used to describe me all my life. Meg,
Let's
rather.
take some
Yes,
calls.
we've been getting some calls.
Good morning to you, caller. Thanks for calling. We appreciate
Hey,
your
good morning,
patience.
Carlson.
Good morning to you,
Good
my
morning,
friend.
Trudy,
Good
and
morning.
Dr.
Cognates.
Cognates.
Dr. Cognet.
Good
Yeah,
morning.
great program. But I wanted to interject a few things, maybe just, I don't know if I'll make the trip with you, and yes, I am. Let me start by saying a couple of things I heard you mention with children and all the different, malnourishment, I want to say, that causes these different problems that you see. Something I've seen for a long time, with the busy parent syndrome, a lot of parents are actually not cooking real food. And I think
That's
that is one of the problems. And I have children. I have 6 children. I was part of their lives going through school, and I can tell you I had seen it to the point where even my last child, which is my daughter, which is 19 now, when she was going to primary school and secondary school, the kind of meals that she used to come to school with, children used to ask her, what is that? And we were talking about real foods there, and they didn't know what certain real foods were because they had not seen that. They only came with their packaged salt and their packaged sugars. I wanted to make like that because in the busy parent syndrome life, that's what you get. Parents just buying packaged stuff and give their children to go to school. And I really want you to weigh in on that because where those children, when you have a child growing up, that child needs so much of the different nutrients to bring that child up. And you actually, you as a parent, you call your child a picky eater, but the picky eating is because you start to give the child things that actually trick the taste buds and have a liking for what is not good, and what is good you're not introducing it. So I don't want to say too much. I want you to weigh in on that because that's what I have seen over the years, and we're talking about almost 20 plus years because my daughter is 19 now, and I had children before her, and I was seeing that already. So we have a society that's actually lost when it comes to bringing up young ones. You're going to have the bad teeth, the bad skin, the skin disease, everything because your nutrition comes from good balanced diet, and that is not happening. And not even using supplementation when they're not eating well. So I want you to weigh in there. Enough said. Have a good day.
Thank
Nice
you so
program.
much. Very good
He's
observation.
yes, he's very much correct. What do you call it?
Busy
Busy
parent
parent
syndrome.
syndrome. I've never heard it. I'm spoken to like that, but it's really true. As working parents, a lot of times the convenience of the quicker to prepare food, which may not be the healthier options, that might be number one on the menu. One of the things parents can do is, so a lot of times for ourselves as adults, we speak about meal planning. That's something I speak up to my adult patients a lot of. The beginning of the term is about to start, and I have been doing that from since last week on my Samsung Notes. I have been listing snacks. So you can do day 1, day 2, day 3, and do some snack planning, some lunch planning for your children. So you have an idea up front. One of the things is parents are so busy that you're like, okay, what we're going to eat today? Or what am I going to prepare today? And you're like, boy, I don't have time for this. I don't have time to prepare, or so many things on my mind. I can't seem to think of it. So if we do meal planning for the children, that would help a lot. It's that overwhelming feeling in the moment of what do you give now? But when you sit and you think about it and put it together, it doesn't have to be expensive.
True.
It doesn't. I know a lot of persons say it's expensive to eat healthy. It's also expensive to manage a chronic medical
That's
condition. And sometimes a lot more expensive.
Very true.
And it's not just expensive with money, it's expensive for your life. And so meal planning is one of the ways that parents can tackle that.
Like at our home, my wife cooks in the evenings. So in the morning, she doesn't have to deal with the hustle and getting up at 4 o'clock to cook. So she cooks in the evening, have the food cool, baggage, pack everybody's stuff, it's put in the refrigerator. Next morning is just to put them in lunch bags.
Yes.
So even you just look at again time management, what works best for you. Some people
Yes.
they're very disciplined to get up 4 o'clock or 4:30 to begin doing things like that. Some people it's more difficult for them.
Yes. Another thing that he made mention of, we get, and I say that a lot. I say that even at home, I say that I've said this to my husband. We get the children taste buds accustomed to a lot of things that we would prefer they not eat. And then when they ask for it, we get upset. Oh, that's all you want. But how did they get to know how nice that tastes?
True.
Sometimes they may go to a party and they may get it
Yes.
once off, fine. But when you give it to them repeatedly, they they are children. So first thing they're going to gravitate towards is the taste. They're not concerned about the nutritional value of the food.
Sure.
That's our concern. And so one of the things that we say a lot of times to parents is what the child eats depends on us. How much, which is very difficult for parents, how much they eat depends on them, because a lot of times parents may feel like the children are not eating sufficiently. And we take their weight, we measure them, and we realize they are growing. We do our well visit assessments and see there are no deficiencies. So it means the amount they've been taking has been sufficient
For
for
them.
them. But we sometimes have this idea that they have to eat a lot. So you may see children having 3 different snacks. They may have a fruit, a juice, and water, which is juice, because they have fruit and water already. They have a yogurt and a biscuit, and everything has to be eaten at one time. And when the
Yes.
child don't eat it, then you say the child
Juice.
is not eating. But then you may put in that bag a little conkers. My bigger daughter gets upset when I tell her not to take my money to buy cushioning. Because to her, oh, but mommy, I'm like, yeah, but mommy, what? That if that's all you're going to be eating, that's all your taste bud is going to want to eat.
Yes.
And so you have to learn to eat things that are more healthier. But we have, as parents, have to learn to prepare and present those healthy things in a more palatable way to the children. We say you have to eat your vegetables, and we just give them raw vegetables. And the children, as a child, my mother told me, if you don't want it, lie down by it. And best believe I lie down by it. I laid by it because it was just not tasting nice.
Yeah.
And so if we want the children to eat healthy, we have to make healthy taste nice.
Yes. Let's take some calls. The calls are really coming in. Good morning to you. Good morning.
Good morning to you, Mr. Carlton. Long as you hear your voice, that is the real fireman touching base. You don't want to have the health program like to be involved because health is life.
Definitely.
If you healthy, you can't be wealthy.
Yes.
You know what I'm saying?
Definitely.
No, Mr. Carlton, no, really and truly, your program is a good program. Your brother call it, make a lot of sense.
I
But
appreciate
the
it.
problem we have, Mr. Carlton, since they bring the slaves on the plantation, to me personally, the food was never right, but we was going to the flow. Now we sweet food from the soil to your pot, you call that alkaline food. You know what I'm saying? Right now, you find the acidic food now take over. Everybody take out poison and you would bring to the house. Now the parents don't have time for themselves. If you don't have time for yourself, my lord, you can't have time for your children. Let's get it real. You know what I'm saying? Now, you know the world we live in. Everybody wants it right now. Everybody wants it fast. People don't eating to be healthy and to be strong. People are eating to get a full stomach, as you call it, to a big stomach. You're just eating because you're greedy or maybe those don't know what to deal with. You have to eat right now to be healthy. For instance, if the COVID virus was there, I don't know about that. I don't know we bring it always come, but it's a form of health. People never learn nothing. You will let me go back to the same habit. Once upon a time before KFC was in River Nika, right? People would come to town from the countryside. They would buy the little chicken, the little whatsoever, they fish, they puff in the bagay. Watch how they used to look strong and healthy and strong and nice and beautiful. Right now, since KFC come, all boxes going up. Bring for husband, bring for auntie. Watch how the devil people them below. Big stomach, big and fat. We still have thick ladies, beautiful ladies in River Nika. Thick. Right now, we have fat ladies. You know what I'm saying? And get life serious. The
Thank you.
foods that we've been eating is acidic and blood. We need to get more to alkaline food. And before I roll out, the food nowadays, as you realize, is one grower. Before we had two plants, but right now we have one grow. Eat and die now. We need to get the real foods in our life because it's what you eat that builds you up. You know what I'm saying? So people of the world, don't forget the messenger, but remember the message.
Thank
Health
you.
is important. When you're healthy, you're wealthy. If you're wealthy, not healthy, you crash. Mr. Land always call your program. You have
Thank
a great
you.
program to your guests. Up and running, the real fireman running. Bless up, give thanks for life.
Thank you. Doctor, I just wanted to make a comment there too. I suspect it's almost in line with what he's saying. One of the habits too that, again, we have here is if you do well, I will take you so and so.
Yes.
I will give you that treat. And it's sometimes
Form
even
of
for
reward.
even you know, or you come home every day and you bring a lollipop, and next day you bring something else, and oftentimes it's not the healthier choices.
Yes.
And your children, sometimes they are not even really excited to see you, but they're excited to receive what you would have brought to them because you've spoiled them, so to speak. That is something that we see too.
Yes.
How do we kind of break that?
So
that
we have
trend?
to break that at the
Mind.
parents' level. We have to change our habits as parents, and we have to think that we have to realize that rewards are supposed to be positive things for our children. and eating healthy is a positive thing. And so we should not be, it's plain and simple, we should not use those foods that we tell the children, you're eating too much of this, I don't want you to eat this, that's not good for you, but we are still giving it to them. So that should not be our reward. Or a reward, what about we use a good experience for the children as a reward? So
Or an
you,
activity
or
or
right, something of
exercise,
that,
something.
instead of using junk food as a reward. Junk food at no time is a reward, it's never is a reward.
And it's so difficult to reprogram the mind because, even as adults, we grow up rewarding ourselves
Yes.
with food all the time. We
Sure.
go out to eat at a nice, place and eat a lot when we want to treat ourselves. So it gets into the mind from young. Yes, Carlton, our lines are going.
Yes, let's take this caller. Good morning to you, caller. Thanks for calling.
Hey, Mr. Lando, I need your number, because we have to talk something privately.
Oh, sure.
That's it.
I'll give that to you. Call me at Jolly's.
Ask Mrs. Dover to give you my number. I need to talk to you.
Sure.
Two right calling. I think Carlton have caller ID on me. And they not answered my call. Blessings to you all, ladies and gentlemen.
Thank you.
Bless
We have another caller. Let's take this
Yes.
caller. Yes. Good morning to you, caller. Thanks for calling.
Yeah, good morning. Greetings, Carlton, and the guest in studio.
Yes.
And greetings,
Morning.
Dominique.
Good morning.
Good morning.
Carlton, I appreciate the program this morning because we have a serious situation. I don't know what topic you're on, but I heard because I'm a time difference. I'm in the States, but I heard you're talking about the diet, the nutrition, and the children on obesity and those things like that. I think we should take example from when we were, like you and I were younger. The things that they have right now, we didn't have them. So I know how to speak for myself. I was growing up in Point Michel. In the morning is a lot of fruits, mangoes, the guavas, papaya, and those things there. And we used to enjoy soda, but we used to get it once in a while. But now sodas and those things is more prevalent right now. And but 25 cents or dollar juice, those things is more right now, which was doing a damage in our children. Too much sugar. Our diet before was much better than right now, because we didn't have KFC. And I'm not against KFC. Not like you can do whatever you want, but we had more of a natural diet. And the women having children right now, they don't take the time to feed their children right, and a proper diet helps one as far as their education and their physique. It's very important for a child's diet and the future with our children growing up. So I think we should take example on the past, what the individual in the past, what their diet was. And we have the natural soil, the water, and those things like that. So it's no problem to continue that. Just we have to make that concentrated effort to feed our children. Because if that's your child, that's your offspring, that's your future. You're supposed to have the best interest for your children as far as their diet. Look at right now our water. A bunch of chlorine. Chlorine is a poison. Dominic have a lot of spring water. There's no excuse we shouldn't give our children the spring water and come together to advocate the chlorine removed.
Thank you,
So
caller.
this is the thing we have to do to help our children and their future and their physics. Thank you.
Thank you, caller. Dr. Cognet, let's take this other caller. We have 15 more minutes, and there's some areas we want to discuss too. Good morning to you, caller. Thanks for calling.
I want to be quick. I wanted to continue, but you cut me off.
Oh, my apologies.
Yeah, just quickly. Look at how brutally obvious a global agenda or objective is. You have the secret ingredients. A lot of the additives are not natural things. They're made in laboratories. And like cocaine, you get addicted to foods. I have watched chill programs where you have children locking everything, the refrigerator, the cupboards, they're locking, and they will go by the neighbor and steal. That is not normal, and they're obese. So they give you the ingredients. Then they make you obese because you're eating too much. Then they put you on a diet. Very interesting. Eat in moderation. It is not good for you, but just get mad and eat in moderation. I'm just being a little sarcastic there and playing on words, but it is for real. The ingredients make you greedy because they're addicted. Additives that keep you addicted to the food. You open the bag of chips, you just want to eat more chips. Is it just because it tastes nice, or you get addicted to it? And a lot of the chickens and many other things. So the system have us right where they want us. Our children are not our children. We think they are our children, but we can. What if you can control something? How you can claim it to be yours now?
Thank you, caller. Thank you, Dr. Cognet. I wanted to touch a little on cognitive development in children. See, we're talking about school. We're talking about everybody wants a child to do well at school, to pass exams, and so forth. Have you been seeing some challenges relating to children's cognitive development, their behavior? Have people, parents, been bringing children to you? Maybe sometimes you've had to make recommendations. What are you seeing?
Yes, I am. And quite often, as a matter of fact, and there are occasions when I've had to refer parents with their children to clinical psychologists, even psychiatrists. And but before that referral, we have to make sure that it's not an underlying medical condition causing this. Earlier on, I spoke about some deficiencies that can interfere with a child's attentiveness and their ability to learn. And so we have to make sure that we remove all of those things out of the picture before we say, okay, you need to be referred to an adjunct healthcare practitioner. There are underlying medical conditions, even like hypothyroidism in children.
Yes.
That's one of the things that can have issues, that can cause issues with cognitive development in children. So it's something that I have realized that I'm seeing more and more of. Yes.
I've seen a rise in autism in children. I recently, a lady was talking to me about this, and I referred her to a particular expert that I know deals with the evaluation of children. And she said to me that was the diagnosis. It's something that sometimes parents are not aware of. They might have a child and they recognize the child is 5 years old, the child's still not talking or doing certain things. What advice do you give to parents in terms of identifying some of these signs that can be deemed abnormal in the child's development at that stage?
Do the child's well checkup, because during that time we go through the developmental milestones and we see what the child has reached based on. There is no child that is going to every child is not going to meet all of the milestones all at the same time. You have some children who may develop differently, but there is definitely something wrong if the child is non-verbal at their 3 years of age, 4 years of age going. So you do the child's well checkup, and a lot of times during those times, parents are made aware of things that are not how they should be. Listen to the teachers, because there are times teachers point them out, and sometimes parents do get offended when it's pointed out. But listen to the teachers. The teacher mentioned, and a lot of teachers, because of their training, they are made aware of those conditions as well. I am very careful not to say I'm seeing more of it. I sometimes say it might be the awareness that has
increased,
grown. So you have persons who may not willingly bring their child because they are now aware that, okay, my child is missing some developmental milestones at this age and I need to have it checked out. So it may just be the awareness that has grown.
Yeah.
That makes sense.
It's difficult sometimes to know whether it's an increase or if people are just more aware. Doctor, we approaching quickly the end of our time, but I really wanted to get from you some specific tips as it related to health and wellness for parents of children at the different ages, that are returning to school or school age children. I know, for instance, preschoolers, a lot of parents maybe who are sending their children off for the first time,
Like myself.
yes, to a new
crying.
environment, and they may be anxious about so many things. I wanted to know what is your advice for that parent, and then of course moving on for the parent with children returning to the primary school level, or for parents of adolescents. What are some of the concerns that they may have?
Okay, so preschoolers.
Mhm.
Separation anxiety is a big thing. But you find a lot of children right now, because both parents may be working, guardians working, a lot of children have been able to have the opportunity to spend their days away from their guardian, away from their parent. And so those children it may be an easier transition to go to preschool because they're accustomed to being away during the day from their parent, but it's still a new environment. So talk to the children before. Like I was saying, my 3-year-old is so excited to go to school. And when she went there, she saw one friend she knew from her babysitter, and in her head, well, she's maybe listening now, so she might hear, my friend is not going to be there when she goes there. But in her head, oh, my friend is going there, and I saw my friend, and she's excited. I keep telling her about activities that they do at the preschool, knowing what her interests are. So she's aware that, okay, they're going to be doing things that I like. Every time we pass by her preschool, my school, she tells everybody the name of her school. My teacher says this, my teacher says that, because we get her excited about it. So speak to the children about it.
Okay.
Same as the teenagers. They had a fun-filled summer, and they may be a bit more in a blue mood going back to school. So you have to try to listen to them, keep an open conversation, open communication with them, get their feedback on how it feels to go back to school. I know as working parents, as working persons, when we go on vacation, the 2 days before our vacation end, we are down. And
sad.
It's the same thing the children experience. So listen to them, remind them of all the fun extracurricular activities that they're going to experience during the school term that they no longer had during the summer break. The teachers who they spoke so highly of that they're going back to see, their friends who they missed. So remind them of the things that they missed about school, because during the summertime it can be very easy for them not to remember. So a little gratitude journal, gratitude board, to make them be grateful for the things that they've been having during the school term that they may have had even realized. It's the same thing as the primary school age children. Keep them excited. Go through their new books with them and let them see exciting stories, exciting things. They get very excited about the school gear. Very excited about that. Well, allow them to be excited. I mean, don't dampen their spirit like, oh, it's not that you're going to school for. It's something that's related to school. So let them be excited about it. Don't let them feel like they have this whole weight of the world on their back because they're now going back to school. So that's one of the things that parents can do. Develop that excitement from now. The other thing that parents should have already started doing from about last week or week before to now is go back to an established sleep routine. Let me tell you, this is the thing that the children like the most about vacation.
Stay up late.
But it is going to affect their cognitive behavior at school. They're going to be less attentive, irritability. They're going to be having this labile mood because they're very tired, they're not resting. Preschool age children, how much sleep do they need? Very surprised. It's so many hours. Persons might say like, what, 10 to 13 hours? 3 to 5 years? Yes, they need those hours. School age children from the age of 6 to 12 years, they need about 9 to 11 hours. And then our teenagers need about 8 to 10 hours of good quality sleep. A lot of times that's not established, and we expect them to wake up in the morning, stretch, be happy to face the day ahead and be a perfect student at school when they're not rested. They need rest for proper brain development, for focus, for proper physical development as well.
Many parents who have teenagers now have to either put up the Wi-Fi, hand me the phone, because while parents are sleeping,
they are up.
The teenagers
they want to be
are up 1, 2 o'clock playing
Challenges
games.
of technology.
But the parenting is important. I know I grew up with a very strict bedtime. And even when, cell phones came in my later teens and so on, my bedtime was still very much enforced. It was 9 p.m. And so I grew up with that. And even now people say I'm a fool because I will sleep. I will sleep early and I will wake up early, but go to bed very early.
But you'll be surprised though, by a week of doing that sleep training or that routine, your body is going to start going into its rest mode once that time starts approaching.
Yes, the bedtime. And I notice a lot of people don't enforce a bedtime now. So I think it's a good practice, that you recommended for parents to engage with that sleep routine. I think it was helpful for me. And as you mentioned, it's helpful for, the students to get a particular amount of rest. Doctor, another question I had in regards to, you mentioned earlier, a lot of the things you see is infectious diseases among children. A lot of parents with students with children going into preschool might be extremely anxious about that infectious disease increase that they may see. I know I have friends who are parents who are so on edge about the child picking up something at preschool, because they say, preschool is where all the cold and the flus and the this and the that, everything is circulating, and they anxious. What about that concern?
That's a real concern that parents have, and I've heard parents say that, especially parents who babysit their children at home and they've not been exposed to other children.
Yeah.
And their immune systems are very immature at that age. But how our immune system develop antibodies is when it comes into contact with the different infectious agents. And so one of the things that parents should have already started doing, and if they have not, start from today, is speaking to, again, the open communication. Speak to your child about, it's okay to share. It's not okay to share what you drink from or the utensils we give you with other children. Speak to the child and teach the child proper hand hygiene. Before you eat, after you use the washroom, and you do it at home. Don't just tell them they have to do it at school, and when they come home, you allow them to do what they want. It has to be something, a practice that you carry across the board. So those are things that they can be they have control of. The other thing is water. Give the child the water that they go with.
Okay.
Give the child water they go with, so they will not have to drink from the tap. So you can control what they consume.
Definitely.
It's a good idea.
We didn't speak about, because I wanted to touch that quickly, hearing and sight evaluations, because these are two
And dental.
sense
And
and dental.
dental.
These are very crucial, especially the sense of seeing and hearing properly in the classroom, because sometimes children do see, like I'm not seeing the board, and sometimes parents don't. They are a bit abstract to these comments. And the child really may have a sight issue, a visual issue. The very same thing with hearing. We know that music have been played much louder than before. Children may be in a house with very loud music. They may have headphones as well, and have the volumes really, really high. How are these impacting our children now?
It's if a child is not able to see what the teacher has on the board, they're not going to be able to know what is part of the lesson. It's going to affect their learning. And then they may get distracted with other things that interest them, because, hey, I cannot partake in what's happening. Children, if they have a hearing issue, the teacher might feel that they're being stubborn or disobedient. It may just be the child did not hear you. And again, at the well child checkups, we would check those things and address them. And I've had parents bring children and say the child has complaints of headache. I'm not sure if it's true because it's only at school, but guess what? It's only at school. The child has to sit from way back and try to focus on something all the way at the front. And we have realized children have had vision issues like that. So that's why it's important to do those well checkups. We don't wait when a concern comes up. We can hit the nail on the head before it starts affecting the child's performance at school.
How much time, quickly, should children spend on those devices? Because that's another area.
It depends by age. It's age.
It's by age.
It's by age. But a child who is in preschool age, outside of the academic use of it, shouldn't have more than 1 hour.
Wow.
Yes. But it's by age. It's just like water consumption is by age and the sleep length is by age. Yes. So it's not like a one size fits all.
Because that's becoming a big issue.
Yes,
now.
It's becoming a
The
big
children
issue.
developing
Yes.
shoulder problems, arthritis in the neck.
And
they are
because
just
of the school bags as well.
Yes.
That's okay. So you asked me earlier on what are some of the common complaints? That scoliosis, neck pains, back pains. And sometimes it's not only because of the poor posture, it's because the parents bought the wrong bag. Because the bag's supposed to be fitted on both shoulders, snugged. If it can have a strap around the wrist or around the waist, that would be perfect. Sometimes you see the little children and they have school bags that are meant to be for teenagers. So the school gears have to be age appropriate. And again, the desks, you may not be able to have any control over the desk at school, but the desk that the child is using for their homework. Yes, when they're home to do their work, their desk and their chair, you make sure that it allows them to adapt a proper posture.
Doctor, as we wrap up, our time is already at the end. I just want you to reiterate the well checkup
Your
How,
well child.
well child checkup. How often should that happen? And also to share your information, so that people, yes, people may contact you or come to visit, make an appointment if they need to.
Okay, so the well child checkup, or it's
Mhm.
basically your annual visit. You
So
do
once a year, okay.
You do that visit. There's no concern, but you just want to make
Mhm.
sure that everything is how it's supposed to be with the child's body and mind.
Okay.
And again, my name is Dr. Midalia Mary Cognet. I'm a general physician in private practice. My office is located at McIntyre Lane, 30 McIntyre Lane.
Mhm.
It's downstairs the office of the Dominica Cancer Society. So that's where
That's
I'm
in
found.
Goodwill.
And I am not only a general physician, I'm a very passionate health educator.
Mhm.
Your
Okay.
number for
Yes.
the
265-2601, and they can reach us via call or WhatsApp.
So that's 265
2601.
2601.
Yes.
I know after we have Dr. Cognet on, people might ask me what
Yes.
what is her contact? So
Yes,
I need to
yes,
take
that
that down.
happens all the time.
Yes, 265 2601,
And
and
they
they
can
look
follow Emerald Healthcare Limited on Facebook. Emerald Healthcare Limited.
Emerald Healthcare Limited. Perfect.
Dr. Cognet, it was a pleasure having you on with
It was
us
a pleasure
today.
being here.
We truly appreciated the information that you shared with our listeners, and we do hope that many parents would have listened, grandparents, would have listened and would be able to make, some valuable changes in the way that they deal with their children and they monitor their general health and wellness. Again, it was a pleasure bringing this episode of Health Vibes to you. As usual, your health is indeed your greatest resource. Have a good morning, everybody, and remainder of the week. Take care, everybody. Bye-bye.
Bye-bye.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is